Hey everyone, welcome back to the Pain Pod. In this month's episode, we're talking physical therapy with Katie Wiley, a skilled physical therapist at Integrated Pain Solutions. With over 8 years of experience in orthopedic care, Katie shares what to expect at your first PT appointment, how therapy fits into a pain management plan, and common hesitations patients have. Whether you're a patient, provider, or anywhere in between, there's something for you to learn in this episode. Let's get started.
Thanks for coming today.
Thank you for having me.
Yeah. Why don't we start off with you telling us a little bit about yourself
Sure.
and what brought you here?
Yeah. So obviously my name's Katie Wiley. I'm a physical therapist. I've always been really interested in healthcare. I have family members, my mom included, who are nurses.
Okay.
So I've always been exposed to that kind of environment. I've also always been an athlete. So going through high school, I played a lot of competitive sports and was injured playing one. And so I went through rehabilitation for that and was able to get back to playing. And it really surprised me how effective it was. So that's kind of got my foot in the water with that and really enjoyed it and loved learning all about it. So straight out of school, I worked in an outpatient orthopedic practice for quite a long time, and I got exposed to a lot of different things. I thought it was really interesting how, especially acute injuries, everything was very similar to what you're taught in school, but the more chronic injuries were a little different layer of things, a little more challenging. And I also ran into that with working. I worked a little in assisted living and home care as well, and it's kind of similar presentation there. How there's a little more nuance to it. Sometimes people need a little different approach than what's the textbook answer to things. So yeah, that's what kind of got me interested in physical therapy for pain management. And so when IPS locally here was ready to start their own program, I kind of jumped at the opportunity.
That's awesome. So what makes it's interesting because you touched on working in chronic pain and assisted living, and then you've come here.
Yeah,
Obviously, chronic pain is a little bit different than acute injury.
for sure.
What's the philosophy and the difference in your practice here that you would say is probably a little bit different than your typical acute outpatient physical therapy?
Yeah, that's a really great and important question. So, when we first started the practice, a big part of what we wanted to do was incorporate one on one care, which you really can't get in a lot of local outpatient orthopedic practices, especially for our more medically complex patients. That's really important because you get to understand more of the nuance of what's going on. And all my patients see just me. So, it's not incorporating care with other physical therapists or PTAs. I see them every week or a couple times a week, depending on the person, and I'm able to adapt and know what is going on with them. Also, we incorporate a wide range of treatments. So I have a little additional training in pain management strategies and more of the education on what causes that and what can contribute to. So in addition to the more traditional care, I'm able to incorporate other layers of treatment and things that are a little more unique for each person.
Could you go into a little more detail on what specifically pain management strategies are when it comes to physical therapy?
Right. So we definitely lean in a lot to not just the pain and the injury, because that's certainly important, but also the functional part of things. So even though, say, we're looking at somebody's chronic back pain or chronic knee pain, we're going to look at their whole leg. We're going to look at their back. We'll even look at their upper back just to see, okay, how can those elements impact their alignment? But then also, how is that impacting their day-to-day life? And what are ways that we can improve that biomechanically? We can improve that posturally, or can we make adaptations? Can we make this look a little bit different, whether it's with a different piece of equipment or a different movement strategy? So we try to incorporate all of those aspects of things in addition to the normal like modalities and soft tissue work. And I have, again, additional training in all of those types of things too.
Awesome. What are some common misconceptions you think patients come into physical therapy with, or maybe prevent them to try physical therapy after they've seen one of the physicians and they recommend they come and see you?
Yeah, so I would say physical therapy is definitely not one size fits all. And sometimes people have not had success with physical therapy in the past. So I think knowing that just because you haven't necessarily had luck with a certain strategy in the past, knowing that there are different ways and different methods. And I'm always very sure to check on what people have tried before, maybe what's worked for them, what hasn't worked for them, and making those adaptations too. And just knowing that I kind of meet people where they are functionally. So,
Okay.
I have patients who really, are primarily using a wheelchair, and we're able to still do a lot of things there. And then I have on the other end patients who really want to exercise and work out, and we're able to kind of adapt their program for them. So no matter where you are in like your pain journey or your mobility journey,
Yep.
we can meet you there, and there's no giving up. There's still always things that we can do.
Okay. There's always some sort of tool in the toolbox.
Exactly.
Awesome.
Yeah.
That's awesome. So walk me through like a new patient visit for a person who's come in for therapy.
Right. So similar to what I was talking about the first day, I like to hear all about the history of the person, as well as what they've tried, what's worked, what hasn't worked. I obviously want to know about the pain and the mobility and the strength and all the things we look at, but also we talk a lot about function, like what can't you do that you want to do now, or what's really hard for you. If you're having difficulty standing and walking, how long can you stand right now? How long can you walk? And what are ways that we can improve that? Are there devices that might help, or is it something where if we strengthen certain muscles or work on certain body mechanics that we can work on that? We look at balance. I mean, even patients with neck pain can sometimes get altered balance just because of some of the stuff they're dealing with. So just knowing that it's a whole person that we're looking at and not just one thing, we really kind of take a look at all of that. And then compared to more traditional outpatient or like post-surgical physical therapy, people don't have to come 3 times a week if it's not indicated, because this is a more chronic injury. Certainly there are cases where we see patients twice a week, but sometimes it is once a week, or if a patient lives far away, once every other week. It's really very personalizable for patients. And again, just meeting them where they are and what kind of time they can commit.
I'm glad you bring that up. We did have some people come in and ask some questions for us for the podcast to go over.
Oh, sure. Okay.
Yes.
Sounds
so
good.
very exciting.
Yeah.
One of them was time. A lot of people say that they don't have the time to come in because they're apprehensive or concerned about the amount of time they're going to need to devote to taking time off of work or taking time away from family to come in and start physical therapy. What does that typically look like, right? Everyone's going to be a little bit different. We're just going to say that, but what would your just ballpark generalization be for it?
I'd say I tend to see the best results with people early on. We usually say it takes 4 to 6 weeks to see big changes in patients' function, their strength, their flexibility, everything. Okay. So that's a good kind of starting ballpark. Certainly when patients are seen more consistently, sometimes that can be a little faster. But I'd say generally if I can see patients once a week, that's a good target if at all possible. If not, it may just take a little longer to see consistent results.
Right.
Sometimes too, patients aren't as good about staying on their home program, and it does take a while to establish that new habit, a new activity. So that's actually something I often strategize with people. When can we fit this into your day? When with this treatment can we, do you have free time in the morning, first thing, or middle of the day, or more end of the day? So I try to plan that out if there are those concerns. But yeah, like I said, I can really adapt the program just based off of what kind of time the person has and making it a part of their day. So it's not a burden.
Nice. And it's not something they're going to have to do for like the rest of their pain journey, right?
Absolutely not. Sometimes there are episodes of care. So say, I see somebody for a month or two, they're doing much better. They have a good program, but maybe something changes or something, something else pops up. Then certainly I'm here as a resource and can see the person again. But it's definitely not something that you should be coming for a year. That's not how physical therapy is intended or designed. We're trying to arm you with tools to make your mobility and your function and your life better. So, outside of maybe following up for 1 to 3 months, maybe max. Then after that, we're like, okay, where can we go from there? Or we can taper down and come in once every other week or once a month just to make sure things that are moving in the right direction.
So it sounds like it's a very like flexible cadence depending on where the patient is and their healing. Okay. Right. I think that's good to know. I think that's something people are generally really concerned about.
Yeah, understood.
And what's that relationship look like with you and the physicians, right? So they're the ones who are typically recommending that you know, it could be one of our physicians, it could be an outside physician who
Mhm.
recommends physical therapy. What does that relationship look like with you and that physician?
Right. So it's a very open conversation, which is part of what I love about our practice is that I can very easily touch base with a referring provider if things are going really well,
Mhm.
or, if there are additional concerns, or say we think that a piece of equipment might be appropriate, a
Yep.
belt or a brace or something along those lines. It's very easy to talk with them, and they'll give obviously their guidance and their input on care, and we
Mhm.
just adjust accordingly. So we're all very much on the same page of wanting to get the patient better and get them moving better. So we're all very communicative here.
Nice. There was another one that a patient had written in about,
Yeah.
and it was concern about this feeling of they saw a physician, they saw their imaging, and
Yeah.
then they've come in and they're really, really concerned about, the imaging says this, so I feel like I'm really restricted.
Right.
How do you approach that? Like, what's your recommendation to people when they're actively participating in their care, and that's definitely what we
Yeah.
want, and it's very
Right. For
exciting.
sure.
But how do we help expand their knowledge and understanding of, yes, this might be your imaging, but this is what you still have the ability to do, right?
Well, and I think that's where PTs and MDs as well, but
Mhm.
PTs and what I do are well trained and educated about, okay, we have this going on your imaging. These are things that probably will be helpful, and these are things that are maybe safe to avoid. And just knowing that though the imaging is there and we want to be respectful of it, that there are other factors at play too, right?
Mhm.
So that we have our muscular side of things, our myofascial side of things, our postural side of things, and just
Mhm.
our strategies that we have adapted over time. So those are things we kind of take holistically into the care that we're pursuing. And though we want to respect the imaging, there's still a lot we can do even with imaging that may seem scary or concerning.
Yes, yeah. I think sometimes that can be overwhelming from a
Right.
patient perspective, right? You're in pain, you've come in, you're looking at it, you've
Mm-hmm.
had the discussion. It's sometimes new to people to have to experience that.
Right.
So I think it's good to, like you're saying, like the holistic side of things. I think that's
Yeah.
a really great outlook to have, and understanding of patient care for sure.
Right. And I'm always big on the educational side of things too. And our physicians here in the practice are great about explaining things to patients, but sometimes it's nice to add that extra layer too, or present it with different, pictures or models of
Yeah.
things. So I always make sure to incorporate that throughout the course of care, just so people really understand, okay, this is what we think is going on. This is probably why this is happening, or why this other area. So say we have back pain, we're going to work
Mhm.
on some hip strength or leg flexibility. And this is why, because they're all very connected. So we kind of look at the whole person with that.
That's great.
Yeah.
Um, what do you do when patients come in with goals, right? Of
Yeah.
they want to get back to a certain point. Maybe they're feeling a little discouraged because they're not where they want to be right away. What
Right.
is your approach to that?
Yeah, so that's one of the big things I talk with people about their first day is
Mhm.
their functional goals. Like, what do we want to feel better with or get back to doing? And we kind of work on the different parts of that, right? If it's somebody who's like, I can't get through cooking dinner without being in excruciating pain and they love to cook. All right, well, we need to get more comfortable and more balanced in standing, get stronger in that position, and then incorporating those upper body movements or maybe some of that trunk flexion that we need to be able to participate in cooking and be able to do that. So we'll break down those type of activities and incorporate functional movements, exercises that we think will help with that, or like I mentioned before, additional tools that might help with that too.
What if you have somebody who, maybe they were into working out, right?
Mm-hmm.
They might
Yeah.
have some shoulder pain. Um, they've come in, they've been referred, and they're kind of hesitant on what that means for them in their fitness journey. Like, what is
Yeah.
that approach for you?
Right, that's a great question. And I am always, obviously, being a physical therapist,
Yep.
very pro exercising.
Yes.
But sometimes there are safe or exercises that maybe are a little more stressful that we can adapt, whether it's less weight or maybe a smaller range of motion or a little different techniques. So maybe if we're doing a tricep exercise and their shoulder really hurts, instead of doing more of an overhead based one, we focus a little bit lower so you can still get that exercise, but just in a way that's not going to be stressful to the shoulder, for instance.
Okay. And then I think another good one to touch on is people with arthritis. We see a lot of patients who come in who have really debilitating arthritis, or they're kind of new to a diagnosis of arthritis. So they're kind of concerned on how that's going to impact them. What's your approach with physical therapy for them?
Yeah, so a lot of times with arthritic changes, degeneration, we say movement is medicine. Because like I'm sure any patient with arthritis experiences, when you stop moving and then you go to move, it really is painful and it's stiff and it's hard to get going. So finding low impact, but also really beneficial exercises that aren't going to put a lot of stress on those joints, but also are going to benefit them by keeping the joint fluid moving, keeping the joint itself moving, keeping your flexibility in line. It all helps kind of de-stress that joint. And we always say too, even though there's not maybe as much joint space, no matter which joint it is, if we have the right like foundation of muscle support, it actually relatively does create less pressure and tension in those joints when you have that proper support.
What is maybe like one or two things that you really want patients to know when they're considering physical therapy, but maybe they're unsure if it's right for them in their healing journey?
Right. So, as I mentioned a little bit before, I like to meet people where they are. So it's definitely not the philosophy of no pain, no gain. One diagnosis that can be challenging is complex regional pain syndrome. But there's so much that we can do that isn't the traditional kind of care for that. And again, just kind of finding that good balance of working on kind of the root of things and that functional aspect of things that can really be helpful to support around it.
So I know before you kind of talked about what makes your practice different, your approach. With chronic pain, I know some people are really hesitant, going back to the whole hesitant to coming in because they're afraid, they've been to other more acute traditional settings where it seems a little more intense, like it might cause more pain for them. What makes you different in that sense?
Yeah, so I definitely don't use the philosophy of the no pain, no gain. I'm intentionally gentle. And I really am responsive to people's feedback, right? So I always have people monitor how they're feeling after their appointments. Generally, though there might be other factors to their daily life, but also their home exercise program, how they feel after doing it. And then if there's challenges, then I make adaptations for that too.
Thank you again for coming and taking the time to sit down and discuss with us a little bit more about your practice and your approach to physical therapy and specific to chronic pain. If anybody's looking to book an appointment with you and they have a referral or they're just looking to get into physical therapy, they can reach out to us on our website at ohiopainsolutions.com. They're more than welcome to call any of our offices. Our numbers are listed below. Do you have any final words for us?
No, I just really appreciate getting to share more about the practice. And, I look forward to seeing more and more bright faces going forward.
Awesome. Thank you.
Thank you.